You're listening to Health Professional Radio. Today I'm joined by two guests who are joining me from Victoria in Australia. They are Kylie Palmer and Suzanne Anderton. Now, Kylie and Suzanne are endorsed nurse practitioners and they are the co-founders of the Ocean Road Health Group. And they're here to talk to us about a conference that's coming up in May this year, and it's called Making Waves 2016. And it's a conference for health practitioners and other clinicians. Ladies, welcome to Health Professional Radio.
Thanks. Hello, thank you.
Now, tell us a little bit about Making Waves 2016.
So we've developed this conference to run in Warrnambool in Victoria on the 19th and 20th of May this year. And it's aimed at a variety of healthcare professionals rather than just singling out one group of healthcare professionals. To bring everyone together so everybody's learning similar things and everyone's on the same page. We're offering a variety of different topics, both theoretical and clinical, and it's going to be really exciting.
Now, are you looking to attract an audience of attendees from across Australia or just from Victoria?
Well, we do have attendees from international, so we have some attendees from New Zealand, so we're looking at across Victoria, Australia and internationally if we can.
I see. Now, is it fair to say that the role that health practitioners are playing is not particularly well understood either by the public or in some cases indeed by clinicians?
So not health practitioners in general, but the role of nurse practitioners is definitely not as well understood as it could be both in the healthcare profession and throughout the community. So part of the reason we developed this business was to actually get more exposure amongst both of those domains and increase awareness about what we are and what we can offer to the healthcare industry and to the community.
Now, I think the number of nurse practitioners and the extent to which they're used in the public health system is variable across different states in Australia, as I understand it.
Yeah, that's correct. The number is varied across Australia and the roles are quite varied throughout Australia as well. Kylie and I are both emergency nurse practitioners and we are part of the largest group, I guess, of nurse practitioners. I think nurse practitioners in the emergency department are quite well utilised, but I think we could be utilised a whole lot more in the community and in the healthcare sector.
I know a year or two ago when I was talking to some nurse practitioners in Queensland, the largest group there seemed to be in neonatal care and particularly in rural and remote communities. So I guess it will be interesting to hear from the conference attendees just how it's developed in those couple of years and where they're functioning best.
Yeah, definitely rural and remote is probably where the role actually began and where the most need for it was initially. And from there, they realised that this role could be utilised in a lot of other areas and that nurses actually had a lot to offer to the healthcare industry, just branching out from what they are already doing.
Now, at Making Waves 2016, the conference that's coming up shortly, you're expecting a spread of practitioners, not just nurse practitioners, but across the board.
Yeah, so we've made Making Waves a health practitioner conference. I guess as our organisation believes that healthcare should not exist in silos, so we're taking an interdisciplinary or a multidisciplinary approach where we believe that we can all be educated in the same form and each discipline takes out of it what's relevant to them. So we've got quite a few different speakers and we're trying to make this Making Waves conference really a health practitioner experience inclusive of dinner and a market showcasing the Southwest Victoria and the Great Ocean Road, as well as bringing speakers from Melbourne and as far away as Fitzroy Crossing, talking about experiences of a remote area nurse practitioner. And the metropolitan speakers will include dealing with stressful situations as health practitioners. This is where we find ourselves a lot of the time, where we, go to work, we see something quite traumatic, and then we move on to the next patient. And often we won't think about that until we go home to our families or till later on. So this will be a session where we can learn how to deal with these situations on the spot, giving us some tools to kind of debrief ourselves in those situations, which will be quite interesting, I'm sure. And we've also got a quite experienced ED consultant from Melbourne who's going to talk about when things go wrong and how to deal with that sort of situation as well as sports injuries and a lot of practical casting, eye examination, ear examination and hand examination, plastics. Lots of different things that will be involved in a conference that are relevant to lots of areas in the healthcare system.
I'm sure it'll be a fascinating event to attend. How can people get more information if they're interested in attending?
So you can go to our website at www.oceanroadhealth.com.au. You can also check us out on Facebook by searching the Ocean Road Health Group. There's a lot of information on there that will keep you up to date with what we're currently doing, and we usually post our events on Facebook, so that's an easy way for people to access information. And you can email us at oceanroadhealth@outlook.com.
So the website was www.oceanroadhealth, all one word, oceanroadhealth.com.au, or on Facebook, Ocean Road Health Group. And if you're interested in attending, do get in touch with Kylie or Suzanne through one of those channels, and they'll be able to give you all the details.
There is a link on the website to Eventbrite, which is our online ticketing merchant.
All right, so Eventbrite's an easy-to-use online ticketing merchant, I have to say, one of my favourites. So follow the links there from the website to Eventbrite, and you'll be able to book directly online. Kylie and Suzanne, thank you for your time today. I do appreciate it. I know it's a busy time for you, so thank you for joining us on Health Professional Radio.
No worries. Thank you very much.
Thank you.
Before we go, we just wanted to mention that the two-day event is worth 12 CPD points or equivalent to for nursing staff, and doctors can become accredited from their Royal College after attending.
That's always worth mentioning because everyone loves points.
Yes, they do.
So, if you missed my conversation with Kylie and Suzanne, there's a transcript on our website. There's also an audio archive on YouTube and SoundCloud, and you can access both of those through the Health Professional Radio website at www.hpr.fm. My name is Wayne Bucklar. You're listening to Health Professional Radio.